After retirement, LACERS administers your health benefits. Your active benefits with the city will continue to the end of the month in which you retire, and your LACERS coverage begins on the first of the month following your retirement effective date. Enrollment in a LACERS retiree health plan is not automatic, but will be one of the parts of the retirement process. Keep in mind that LACERS health plans are available if you need them, but you are not required to enroll. If you do not enroll during the retirement process, you have up to 60 days from your retirement date to enroll, or you can enroll during the annual open enrollment period, which is typically in October. You may also enroll if you experience a qualifying event, such as moving in or out of the LACERS HMO service area, or a loss of coverage. Contact LACERS health staff for more information about this. LACERS members may receive a health subsidy for their years of service. A subsidy is a monthly dollar credit applied to the cost of your medical or dental plan premium. To be eligible for a subsidy, you must be at least age 55, be receiving a service or a disability retirement benefit from LACERS, have a minimum of 10 whole years of service, and be enrolled in a LACERS-sponsored medical plan or be a participant in the medical premium reimbursement program. Refer to your retirement estimate on page 1 and look for Health Service Credit. Write that number on your decision sheet in the blank for years of service and do not include numbers after the decimal. This number will be used to help you determine how much of the LACERS health subsidy you will receive and how much you may have to pay for insurance depending on your selections. Retirement estimates can be obtained in your MyLACERS account. Visit www.lacers.org to access MyLACERS and create an account. Alternatively, you can contact LACERS Member Service Center at 1-800-779-8328 or email lacers.services@lacers.org. Staff can save the estimate to your MyLACERS account or mail the estimate to your address on file. In order for staff to provide the estimate, make sure to include your desired retirement date, employee ID, marital status, and the name and date of birth of your spouse or domestic partner as applicable. It is important to take into consideration that your medical and dental plan offerings are dependent on where you live. Not all plans are available in all places, and if you plan on residing in a different state or a different country, it's important to review the medical and dental coverages available and the accompanying premium costs of those plans. If you reside outside the LACERS HMO service area, but within the U.S. and its territories, the medical premium reimbursement program may be available. For more information about this program, please contact a LACERS health representative. You can live in many places throughout the world and still have coverage through LACERS in our PPO plan. However, the PPO plan is more expensive than our HMO offerings, and you want to be aware of your potential costs before enrolling. Please note, the retirement portal will predetermine the medical plan options available to you based on the address you provide. If you plan on moving after retirement, please make sure you answer accordingly and include the correct address when prompted to do so in the retirement application portal. Vision coverage is determined by the medical plan you choose, and the cost is included in the medical premium. If you're enrolled with Kaiser Permanente for your medical plan, then you'll have vision coverage through Kaiser. If you select any other LACERS medical plan, your vision coverage will be provided by Anthem Blue View Vision. In retirement, you can still have providers such as Kaiser and Anthem, who you may be familiar with as medical providers for active city employees. For non-Medicare plans, where you and all your dependents are not age 65 or older and not enrolled in Medicare, you have the choice of Kaiser Permanente HMO, available throughout California, Anthem Blue Cross HMO, available in California, and the Anthem Blue Cross PPO, available in California, throughout the United States, and outside the US. If you or your dependents are 65 or over at the time of retirement, you will need to apply for Medicare during the retirement process. All members and dependents enrolling in a LACERS medical plan who are age 65 or older must enroll in Medicare Part B at minimum. Those who also qualify for Medicare Part A premium free, meaning at no cost to them, should also enroll in Medicare Part A. Knowing which parts of Medicare you'll be enrolled in can be helpful for selecting a medical plan, as your plan options change depending on which parts of Medicare you have. If you're interested in learning more information about Medicare before proceeding, please visit www.lacers.org/Medicare and review the video there. Medicare enrollment affects which medical plans are available to you and your dependents. If you, or at least one of your dependents, is enrolled in Medicare, you will have the following dual care coverage options for the person enrolled in Medicare. Kaiser Permanente Senior Advantage, available in California. SCAN HMO, available in California. United Healthcare HMO, available in California and parts of Arizona and Nevada. And the Anthem Blue Cross Life and Health PPO, available in California and throughout the United States. The persons not enrolled in Medicare, whether that's you or your dependent, will be enrolled in the corresponding non-Medicare plan. Kaiser Permanente HMO for those enrolled in Kaiser Senior Advantage, Anthem Blue Cross HMO for those enrolled in either SCAN or United Healthcare and residing in California, and Anthem Blue Cross PPO for those enrolled in the Anthem Blue Cross Life and Health Medicare plan. If both the member and dependents are enrolled in Medicare, you'll have the following Medicare Senior Plan options: Kaiser Permanente Senior Advantage in California, SCAN HMO in California, United Healthcare HMO in California and parts of Arizona and Nevada, and Anthem Blue Cross Life and Health PPO, available in California and throughout the United States. Members can choose to cover eligible dependents on their medical and dental plans. If a member covers themselves only, they are enrolled in member-only or one-party coverage. Typically, a member might cover one dependent, which is usually their spouse or domestic partner. However, a member may choose to only cover their child under age 26 instead. This type of coverage is described as the member plus one dependent or two-party coverage. Members can also provide coverage for multiple eligible dependents, including children or grandchildren. Having more than one dependent on the plan is described as family coverage. Please note that the more dependents you carry on your insurance coverage, the more likely you are to have an out-of-pocket monthly deduction. In order to determine your monthly deduction for the plans you have available, refer to LACER's Health Benefits Guide. The Health Benefits Guide is your go-to source for information regarding how much subsidy you're eligible to receive, which plan or plans you qualify for, the services provided for each plan, and the costs associated with them. You'll want to review this information thoroughly so that you can make an informed decision. The Health Benefits Guide is mailed annually during LACER's open enrollment period, but is always available for download on our website at www.lacers.org/retired. In the Health Benefits Guide, refer to the Medical Monthly Allowance Deductions section. You can find the page number in the table of contents. This section shows the various medical plans available and their costs depending on the number of dependents that you're covering in the plan, as well as Medicare status. Near the top of each page is a title in orange text that describes the coverage level as retired member only, retired member and dependent for when the member is covering only one dependent, and retired member and family for when the member is covering more than one dependent. These titles also reference Medicare, so make sure to match those to your situation, whether that is not in Medicare, with Medicare Part B only, or with Medicare Parts A and B. Medicare descriptions can apply to the member only, the dependent only, or both the member and dependents. Review the pages in this section of the Health Benefits Guide and find the one that pertains to your situation. For example, a member covering no dependents who is not in Medicare would refer to the first page of this section titled Retired Member Only, Not in Medicare or with Medicare Part B Only. A member covering no dependents who has both Medicare Parts A and B would refer to the next page titled Retired Member Only with Medicare Parts A and B. If you're covering one dependent and both you and your dependent are under age 65, you'll look for the page titled Retired Member and Dependent, Not in Medicare or with Medicare Part B Only. If you're covering more than one dependent, you'll look for the charts titled Retired Member plus Family. Once you've found the correct chart that pertains to your Medicare status and the number of dependents you will cover, look at the leftmost column titled Service Credit and find the number that matches your years of health service credit that can be found on your retirement benefit estimate. Find the column for the medical insurance you're interested in and match the insurance column to the row with your years of health service credit to find your monthly deduction. These amounts show your out-of-pocket deduction after the medical subsidy you receive based on your years of service has been applied. If your medical subsidy covers the full cost of your plan, then your monthly cost may be zero. The cost is what you can expect to pay monthly in retirement for your selected plan and number of dependents. It will automatically be deducted from your retirement check every month. You may wish to make a note of the amount in the space on your decision sheet for reference later. You have two choices for your dental plan. If you live in California or select areas of Nevada, you can enroll in the DeltaCare USA HMO plan, and you have the option of the Delta Dental PPO. If you live anywhere else in the world, you can enroll in the Delta Dental PPO plan. In the Health Benefits Guide, turn to the Dental Plan Premiums and Deductions section. The page number can be found in the table of contents. Look at the leftmost column titled Service Credit and find the number that matches your years of health service credit on your retirement estimate. Find the column header for the number of dependents you'll be covering, and then the dental insurance you're interested in, HMO or PPO. Match the column to the row to find your monthly deduction based on your selection. You may wish to make a note of the amount in the space on your decision sheet for reference later. Now refer to your decision sheet and the Your Health Insurance section. First, make a note of what parts of Medicare you'll have. Members and dependents who are not yet age 65 most likely will not be enrolled in Medicare and will likely select NA for not applicable. If you and your dependents are over age 65, you will be required to enroll in Medicare Part B and will likely select Part B only. However, if you already have Medicare Part A or you know you will qualify for it, please select A and B. If you have a dependent for which either of these cases exist, please make the appropriate selection on your decision sheet for them as well. Once you have decided on a plan, using your retirement decision sheet, note the medical and dental plans you are most likely to select. Make a note on your decision sheet as to the number of dependents you will cover. This number does not include yourself. You will either be covering 0, 1, or more than one dependent. Remember that your medical and dental selections on the decision sheet are for your reference only, and not an official designation.